This is Dr. Steve Horowitz with RotatorCuffRelief.com. So what is a rotator cuff tear? Ouch! First, what does tear actually mean? Well, the proper term is strain, S-T-R-A-I-N. And there's a common grading system that's been used for many decades, grade 1, grade 2, grade 3, grade 1 being the least severity, grade 3 being the worst. If we start from left to right, you can see that normal muscle, all the fibers are intact. In a grade 1 strain, there's small areas of disruption, kind of like a threadbare shirt. And then grade 2, we have larger areas of disruption, meaning more individual fibers are actually torn. In grade 3, in the original classification system, is thought of as a complete and total tear, like cutting something completely with a pair of scissors. But this does not tell us certain things. Where is the site of the strain? And if we're looking at the rotator cuff, if you look at the diagram on the right, is it proximal, which is the medical term meaning close to the top joint, where we have the letter P? Is it in the middle, where we have the letter M, or is it distal or close to the bottom joint, where we have the letter D once again? Also, there's an area called the musculotendinous junction shown by the red arrow. That's the area where the muscle joins to the tendon, and it's the tendon that joins to the bone. So right where the muscle and the tendon join together, that's usually the weak link in the chain. However, in kids, it can be closer to the bone, where actually the tendon inserts onto the bone and can even pull away part of the bone. So in kids, you have a little bit more homework to do to figure out where. So this is where imaging comes in, and in the next video, we'll discuss imaging of the rotator cuff, but we really want to know the where for the injury. So in this grading system, on the left, we have a simple chart where we're looking at pain, weakness, and loss of function. So in grade 1, we have pain. In grade 2, we add weakness to the pain. And in grade 3, we add loss of function. The chart on the right goes into a little bit more detail. Grade 1, we have symptoms. We can have pain, can be sharp, can even be dull at the time of injury, but there's usually pain. Frequently, you're able to continue with the activity. What are the signs? Well, outside of pain and tenderness, there may be some spasm and swelling, but there's typically not any kind of significant loss of strength or loss of ROM, range of motion, loss of your ability to move the joint. And if we're looking at imaging, like an MRI or even an ultrasound, we see very little fiber disruption, so we can't see very much on the imaging. If we move to grade 2, typically there are symptoms where it really hurts, and there are signs where there is a clear loss of strength and a loss of range of motion. You can't move the joint area to the degree that you did before, and when you do the imaging, you see actual disruption of muscle fibers, but to a smaller extent, 10 to 15%. In grade 3, that's the most severe. You have usually severe pain and disability, complete loss of function or very, very little function. Usually there's that palpable defect. So palpable meaning when you feel it, there's a little divot in there. And you have positive orthopedic tests. And on imaging, you have significant disruption of muscle fibers that shows up. What does it look like under a microscope? Well, the green arrows show the fiber disruption. Pretty cool image. In future videos, we'll go over what imaging looks like. The two types of imaging that are done are typically MRI and ultrasound. And what do you do next?